Good morning, everybody. It's Deepa with Matthew. And we got a question in that asked us to look at something we have sort of looked at before, but not exactly this way. We had talked about, like sudden changes in language, sudden changes in the ability to do a task in a certain way, sudden ability to have a shift in alert and arousal, those kind of things. This one was a little different. What happens when you experience a sudden change in mobility and the ability to move? And it was like, whoa, well, that balloon is huge. So, my first question back is, are we talking about gross motor movements, or are we talking about fine, skilled movements in the mouth, the fingers, the eyes, the facial muscles, the the movements of even arm, like, are we talking about strength? Are we talking about rigidity? Are we talking about a tremor? Are we talking about starting to do something and suddenly freezing? Or are we talking about not being able to initiate something? Just right off the top of my head, those are some things. Is like, wow. And are we talking about there was a reduction in alertness, arousal, and function prior to? Is it one sided? Is it both sides? Is it more of a rotational kind of shift? Is it an up down kind of thing? Is it axial, or is it axial meaning on the core body, or is it out in the peripheral, meaning it's out toward the ends, like the feet, the hands, those kind of things out that way. So, Matthew.
And Tipa, I'm curious. Okay, so when we're talking about all of what you just brought up, so what part
Yeah.
of the brain would we be seeing changes like this in? I mean, what is it, the sensory motor strip or something else that we
Yeah,
are
so
seeing?
this gets a little tricky. It could be sensory motor, or it could be spinal cord, because there could be changes in the spinal cord.
Mhm.
So, for instance, if somebody has a nerve impingement, or they have a herniated disc, or they have a collapsed vertebrae, oh, we need to find out, is there pain? Is there evidence of pain associated with immobility? Because sometimes people quit moving because they hurt or they're afraid they're going to hurt. But sometimes that's not the reason that they quit moving. We also want to figure out in this equation, is it a thing that we've done something to somebody to reduce their movement? So, what meds are they on? When did they start those meds? What are those meds? Could those meds interact with other meds? Is the person taking something or not taking, doing or not doing? Has there been some shifting, but it had been okay up to now? And now we sort of tipped over that edge of not being able to get your hips higher than your knees. So, therefore, now I'm stuck in the chair. And after I try a couple times, I just quit trying because I just can't figure out how to get myself up and over. And so breaking the task down into smaller little bits where we shift forward first and we raise that back end of the chair up, that can make a big difference. But if we start doing that all the time for the person, we aren't actually helping them regain that ability. We're just compensating for it, which is an option, but we want to think that through before we start doing it automatically. And that leads to the cerebellar area, which I didn't mention yet. So we have the spinal cord where you might see changes. You might be actually having changes in the spinal cord or the nerves that come out from the spinal cord. You might be having changes in the cerebellar area, which classically look more like an ataxia, which means an unbalanced sort of Frankenstein sort of look, or it could be less able to organize and more difficulty being able to do things that are rhythmic. Um, or it could be sensory motor, or the wiring from the core of your brain to the sensory motor, thalamic connections. So, I've been totally confusing, but not really. Because what I'm actually saying is, if this is happening, we should have support from people who understand the various kinds of mobility shifts and get a good evaluation or good at least assessment of what might be going on so that we're planning the right support intervention to match what is happening. We don't want to ignore things that are acute and need attention, especially when someone's lost the ability to verbalize what they're experiencing. So if somebody's suddenly not moving and they don't have language and they're not really good at knowing where on their body they're having this experience happen, I've always got to be a little concerned about, or significantly concerned about, the possible presence of discomfort or pain that's inhibiting the movement. So I might look for spontaneous, sort of like when people aren't thinking about it, I just reach a hand to start to hand somebody a cup, but slightly out of reach, and say, here you go, and just see if the person spontaneously reaches out and gets it. But when they go to think about, and if there's a wincing or if there's a pausing, or if, because I'm really looking for, could this be hiding something that's, and I'm going to say a fancy term, orthopedic? Could it be hiding something that has to do with bone structure or the structures around the joints versus it is something neurological? So I may want to have somebody help me sort that out. But then there are times where, wow, okay, the condition that the person has is progressing. And so I'm going from more of a emerald to more of an amber, more of a sensory sort of comfort, discomfort kind of phenomena for that. Or I'm going from I like this kind of thing that I'm doing to I don't care about doing it anymore. Now I just hold on to things. So I'm strong. I may grab things, hold things, or I may just push my hands on things, or I may pick at things, but not do things constructively. So there's a lot of variables, is what this boils down to. And I think one of the biggest mistakes we make is not really knowing the details of this any more than we know the details of the brain sometimes. And we don't have providers sometimes who are curious enough with us to help us sort through what might be going on here. Is it a lack of interest or is it a lack of ability? Is it challenges with comfort or is it challenges with appreciating what I'm trying to get you to do? And until we figure out a little bit more, we are sort of in the dark. And so therefore we're likely not to pick something that's going to be helpful for either one of us, all considered. So I'm going to pause there. Matthew, thoughts on your side of the street? You're a PTA from the past. What you thinking in the present? What are you thinking?
What I'm getting from this and what I've learned, especially through doing PAC training and things like that, was that ability of slowing down, pausing, and really looking at the big picture, which, I mean, as therapists, often we do. We try to look at what are the clues? What are we seeing? You know, that idea, though, of giving us more things to look at, like what parts of the brain are we potentially seeing changes in, to stay curious so we can start trying some things out. Like you were mentioning, that idea of putting something just out of reach and saying, here you go, and seeing what kind of response do I get in that moment. And that idea, too, of not just jumping straight into doing something for the person or doing the whole entire thing, making it a step by step, seeing, okay, if I give a little bit of this, how does that help? If I just do a little bit of that, how does that help? So those are some great tips of what I can start to try to do to figure out what might be happening and having them try something out. Yeah, giving the visual, but the idea of doing things like that to see what is it, because there's so many different reasons why we might suddenly see a change, and we may not be getting all the data in that moment.
Yeah. And so I think what I've seen, unfortunately, people assume is that if you can't do it when I ask you to do it, you can't do it. And then I've seen folks get really frustrated with somebody who's doing something when I didn't ask them to do it. They can do it. When I walk away, they do it. But when I'm there, they can't. Mm. You can hear it in my voice. And it's that sense of, well, that's not right. Why won't they do it when I ask? And it's, well, that's different brain areas. So spontaneous abilities are different than purposeful. You respond to what I ask you to do. It's much more complex. So, yeah. So, if we're looking in that book, you may actually want to look at the difference between eh, something that an emerald state person might be able to do and something that an amber state person might be able to do. And then you could even look into ruby state because I think emerald, amber, ruby. Ooh. And then let us not forget that ultimately we'll go from ruby to pearl state. And if you think when you're asleep, that's the best analogy I can give you to being in a pearl state without having dementia in a pearl state. If you think of that, when you are asleep, you're not really aware of your body as it is. You're doing something inside you that doesn't really, you may be dreaming, you may not be dreaming. There are some things that are happening spontaneously you're unaware of, including when you're in various phases of sleep, you move, you don't move. So when you go into deep REM sleep, you don't move. You're frozen. You're actually paralyzed. So you don't get yourself in trouble unless you have dementia, and then you can. But when you come out of that, that's sort of that coming out of that deep state of sleep where there's this fuzziness between, wow, I'm having, oh, that's a dream. Oh, wow, that was weird, kind of thing, where you're coming back into your body, into awareness of your body. So I think when we do it when we sleep, we realize, maybe we don't, that there's a time between when I start and when I transition. I think when we're working with people living with dementia who are in a pearl state, we sometimes try to compress that time rather than allowing that arousal time to go from where the person is wholly inside themselves to where they start to be aware of the external. And perhaps what we think is a lack of movement is a reaction to too much from us. We won't know until we get curious. Till next time, take care with your care, take care of yourselves. Bye, y'all.
Thanks, Deepa. Bye, everybody.